Good afternoon, Guyana, and welcome to Health 360. I'm your host, Alicia Martin. Our topic for today is fibroids, diagnosis, and treatment. Joining me today is Dr. Lucio Pedro. He's the head of the Obstetrics and Gynecology Department located at GPHC, attached to the Ministry of Public Health. Welcome, Dr. Pedro.
Oh, thank you, Alicia. Thank you very much for welcoming me. And I would also like to thank the audience that will be hearing us today, this morning. The Department of Obstetrics and Gynecology is a huge department. As you know, Georgetown Hospital is the tertiary center for the whole of Guyana. So we get people from all over the place. So it's a referral hospital. And just to give you a little hint, each year we deliver about 6,000 patients at Georgetown Hospital. And this is apart from gynecology. Gynecology is a different part of the department. And there we do probably around 400 surgeries a year. And so with me, there are doctors. We are about different levels: consultants, senior registrars, residents, and GMOs. And there are about 40 of us. So that's the what we carry on at the Georgetown Hospital. So today's topic is fibroids. Well, fibroids is one of the most common topics, in gynecology. And just to give you a hint about, if you do autopsies of people, of women who die, okay, you'll find out that 80% of them, this is Caucasian population, 80% of them will have fibroids. But in the Afro-Guyanese or African descent people, about 90% will have fibroids. Wow. So it's a common thing, right? But before I talk about fibroids, I would like to ask my audience to listen to what the do's and the don'ts when they're coming to see a doctor in gynecology. What the do's is, one, this is the dressing, optional, but we prefer usually to have a dress rather than pants, okay? Number two, before you come into that office, all right, we ask you, we need you to have your bladder, urinary bladder empty, the bladder empty, okay? Number three, you should know one of the questions that will come to you, all right? No doubt any gynecology is, when was your last menstrual period, okay? So you have to have those things in that last menstrual period in your mind before you come in. And the other thing that we usually ask is, when was your last pap smear? As you know, pap smear is important because although we have here a program for cancer of the breast that is very much emphasized in Guyana, but cancer of the cervix, it's at the background. Right? But we have a lot of people who are dying unnecessarily of cancer of the cervix. And that's why we want you to do pap smear. So Alicia, now I can go and start with fibroids, right?
Yes, doctor.
All right. So fibroids, as I said, is a common condition throughout the world. And probably around 75% of the people who come to the gynecology will have fibroids, okay? Their primary thing is fibroids. And so, what are fibroids? These are benign tumors, non-cancerous tumors of the uterus. Non-cancerous tumors of the uterus. And what they do, because that's one of the most common things that patients will ask you, is it cancerous? You know, and then you tell them, no, it is not cancerous, not at all. You know, the chances of malignancy that is cancerous is very, very small, and I will tell you that at the end of this program. So, how does it present? Fibroids, how do they present? Okay, most of the time people come with fibroids that you diagnose fibroids. They don't have any symptoms. 50% of them, they don't have any symptoms. So it's a chance finding, right? And the rest of the people now, they can come with bleeding, heavy bleeding during menses, during menstruation, okay? And the bleeding of fibroids is not prolonged. If it is prolonged, something else is there. It's usually the normal 2 to 7 days period. That's a normal period that a woman bleeds during menstruation, 2 to 7 days. But it can be very, very heavy, okay? And so heavy that the patient can become anemic, okay? So they might also present with symptoms of anemia, shortness of breath, dyspnea, things like those. And then what else? And, the normal bleeding in a month for menstruation should not exceed more than 80 mL, okay, for the entire course. If it exceeds that, more than 100, then you become anemic, right? Now, what is the next symptom? The next symptom is you have seen a couple of people which, when they come to you, or you've seen people who appear to be pregnant, and they're not pregnant, okay? And this is an abdominal mass, a mass, we call it a lump, a mass, tumor, okay? It's the same thing. And sometimes it can be so huge that you think that this lady is going to deliver soon, okay? So that's another symptom. Now with that come other things like pressures. Now pressure on the bladder, okay? If there is pressure on the bladder, that means that you're going to pass urine very frequently, okay? There can be pressures on the kidney. There can be pressure on any organ, the bowel. So those are the other symptoms that the patient can present with. Now, the next thing is pain. Pain is not a common symptom for fibroids, okay? If there is pain, some patients do have pain, okay? But it's not a common symptom unless it is huge, and it's pressing on, as I said, it's pressing on another organ. The other thing that happens with people with fibroid is infertility. People are trying to become pregnant and they cannot conceive, right? And it depends on where the fibroids are. The fibroids can be inside the cavity, the uterine cavity, what we call them submucosal, and they can be in between the muscle, intramural, and outside the muscle, the muscle of the uterus, subserosal. So depending on where it is, it can cause different things. And one of the things is that patients with fibroid may become pregnant. There's no problem with becoming pregnant, but if the fibroids are inside the cavity, all right? So what happens is that it's a big, huge fibroid there, and it interferes with the baby, okay? So what happens is that they have this repeated pregnancy loss, abortion, miscarriages, all right? So infertility is one of the things that can happen with people who have got fibroid. Now, how do you diagnose fibroid? Fibroid, most of the time, as I said, it's just asymptomatic, okay? You just find it by chance, incidentally, and somebody comes to do something else, they have abdominal pain and you do an ultrasound, you request an ultrasound, you might find out that, apart from whatever she's complaining about, they also have got fibroids. So incidental finding. Now, for any diagnosis in medicine, you must take a history. Okay, patient will come to you, you take a history. Okay, after you take a history, then you do your examination. Very important. You examine the patient. You know, there are people who go to gynecology, to go to doctors, you know, they are not examined. I don't know why, but the doctor sits down there and writes a prescription. That's not good enough. We have to examine all our patients. And number three, after we have taken the history, we have done the examination, then with those two, 75% of diagnosis made, okay? And then if we have any problems, we do the investigation. And the investigation of choice in the case of fibroids is an ultrasound. Okay? So ultrasound will show you whether the uterus is enlarged, it's got fibroids, but it's got a baby inside there, you know. So the investigation of choice is ultrasound. Now, after you have done that, you have come to the conclusion that this lady has got fibroids, okay? So what do you do next? What do you do next? Okay, so how you manage this lady who's in front of you. So one of the things that we have to do, as I said before, I'm repeating it, most of the people will have no symptoms at all, okay? So what do? You tell her you have fibroids and it is not giving you any problem. So there is no problem. So you can just go on with your life, you know, especially when it is a small fibroid, nothing to worry about. Fibroids always grow up as long as you are having your menstruation, okay? As long as you're having menstruation, they will grow up. Before, they are related to estrogen and progesterone. Those two hormones make the fibroid to grow. So you are not going to find fibroids in people, in young women who haven't started seeing their menstruation. And after menopause, the fibroids do not grow. As a matter of fact, they shrink. Okay? So when it comes to, if you are close to menopause and you've got fibroids, most of the times we tell you, look, it is going to shrink. Okay? If it is not so big. When they are so big, so they're not going to shrink. It depends on the size. Okay? If you've got a fibroid to your, you know, full of filling the whole abdomen, they are not going to shrink. They might shrink a little bit, but nothing's going to happen. Ultimately, you will need some surgery, you know, to remove those fibroids. Then there is also medical treatment. Medical treatment, you will treat the symptoms, okay, like bleeding, pain, okay? So you have got ibuprofen, you've got some, you know, all those pain medications that you can have, right? So that's the medical management. And then you have got, in the medical management also, can the fibroid shrink? Do we have anything to shrink the fibroid? Yes, we do, but those things are temporary because we can only use them to help us if the woman is bleeding a lot, okay, to help us to stop that bleeding. And it can be used only for 6 months, okay? After 6 months, you can't use them. The reason is that you are putting this lady, when you're giving this medication, you're putting this lady into menopause, okay? And not only will she have all the signs and symptoms of menopause, but also she will have the bone, you know, she will have osteoporosis, that the bone will be brittle, okay? It can break with slightest trauma, it can break. So you don't want these people to go over 6 months. So one of the medications that we give is Lupron, that, as I said, cannot be given more than 6 months. That shrinks the fibroid, but as soon as you stop that medication, the fibroids grow back to the normal, to the original size, okay?
Okay.
So, right. So the next thing now we have is surgical management. Surgical management. Okay, there are two types of surgery. One definitive surgery, which is total abdominal hysterectomy, you taking out the uterus, okay, and the fibroids. So that solves out the whole problem of fibroid, okay. The next treatment, surgical treatment, is myomectomy. Myomectomy, you open the lady and you take out the fibroids, leaving the uterus. Okay, and this is mainly for people who have not completed their childbearing. They want to have more children, so you offer them the myomectomy. They will tell you, "I don't want to. I still want to have my children, another child." Some people don't have any children at all, and they present to you with with fibroids. So you offer them a myomectomy if it is possible. However, when the fibroids is very big, right? And if somebody says, I want myomectomy, just remove the fibroid, don't take out my uterus. When they are going to theater, you cannot allow them just to go like that, because they will have also to sign for hysterectomy. Because what you encounter there, okay, during surgery, it might be so, what overwhelming that they bleed a lot. So if they are bleeding a lot, and you can't do anything to stop that bleeding, you don't have any other choice but to take out that uterus. So that's why they have to sign also for hysterectomy, okay. And you must be very clear about that. I personally do not take anybody to the theater for myomectomy unless they sign for hysterectomy, take out the uterus, okay? And that's how the way it should be, because you don't want to go somewhere in the theater and then change your thing without the patient knowing, okay? So how would we do this surgery, okay? There are different ways of doing them. One is open surgery, okay? We call it laparotomy, okay? Open their belly, their abdomen. And then there is laparoscopic surgery, okay? So laparoscopic, that's where we put a couple of, buttonholes, and we do it with laparoscopy. The advantage is that people can be done, you can do something now, and tomorrow they go home. Okay.
Yes.
All right. So that is the biggest advantage. Less bleeding, less time to stay at home. If it is a busy woman who's working, she can go to work. As soon as 2, 3, 4 days, she can go to work. Okay. So that is the main advantage of laparoscopic surgery. And then we have also hysteroscopic. As I said before, if the fibroid is in the cavity itself, okay. So what you do, there is a hysteroscope. Hystero means uterus, so hysteroscope means going inside there and you will look at the uterus, inside, and you can take out that fibroid from with a hysteroscope, okay. So anything else we have? Any other means of getting rid of fibroids? Not getting rid, really, but some people, a lot of gynaes go abroad and come here and say, I don't want any operation. I want something radiological where you can shrink this fibroid, without surgery. So there is something called uterine artery. Uterine artery supplies the uterus. It's the main blood supply of the uterus. Uterine artery embolization. Okay, what is it? In short, is just to block the supply of the uterus. Okay, when you block the supply of the uterus, what happens? The uterus will shrink. It might not shrink, to the size that you want, but it will shrink. It is not going to grow anymore because the blood supply is cut off. So that's another way of managing fibroids. Now, what are the chances of fibroid becoming cancerous? Okay, it's very, very small, very, very small. So the literature gives us a figure of 0.1%. Let me repeat it, 0.1%.
And
Okay.
doctor, this is one of the concerns that many persons would have, if it would turn into cancer or not.
Right, that's it. So the chance of it turning into cancer is very small, 0.1%. All right. So we can tell you our audience can, know that the chances is there, very, very, very small, but it's nothing to be concerned with. The other question that usually patients say they will ask you is, what are the chances? If you have done myomectomy, you have not removed the uterus, you have done myomectomy, what are the chances of these fibroids growing back again? Yes, there is a big chance, because when you're doing myomectomy, all right, you remove what you see. There are small fibroids, small, what we call them, seedlings, seedling, that you can't remove them because you're not seeing them. So what happens is that those seedlings will grow up, and so the chance of a repeat myomectomy, is high if you're trying to become pregnant. And the chance, most of the time when we have done myomectomy, then you have another, the uterus grow up, you got more fibroids, then most of the people will go for hysterectomy at this time. All right. So once we're done myomectomy, remember that your fibroid, not every single fibroid is removed. You cannot do that. It's not possible. Okay. So, Alicia, can you?
So, doctor, one other question I must ask. Is there a particular age range for a person to develop fibroid? For example, persons who have never conceived before, do they have any chance of developing fibroid before giving birth or so?
Right. Thank you, Alicia. As I said, fibroids, you don't find fibroids before the age of menarche, before they start menstruating. Okay. So fibroid is a thing of, the childbearing age. Okay. That's where you find it most common, childbearing age, which nowadays between, I don't know, before they used to be, say, between 15 and 44. Now that age has been extended 12 to 47. I don't know, some books with 49. I don't know. I haven't seen somebody 49 coming, with a pregnancy, but 47 I have seen. All right. So during that age, during that stage, you can develop fibroids. All right. And as I said, if you haven't had a child, and that's one of the most presenting symptoms that, I don't have a child and I've got fibroids. What do I do? What can I do to become pregnant? I said it before, fibroids do not cause you not to become pregnant, okay? But unfortunately, I've seen here at Georgetown Hospital, people telling, some of my doctors telling patients, you can see that she has got a big fibroid, and they still tell them, and she wants a child, and they still tell them, oh, go and become pregnant before we can do anything, which is wrong, absolutely wrong. You can't leave somebody who has been trying to become pregnant for the past, I don't know how many years, okay? And now she presents to you with a big fibroid, and you tell her, go and try to become pregnant. Doc, I've been trying to do that. Okay, and nothing happened. So try to help them. These are the people who we should help before we just send them, to try to become pregnant, because they are not going to become pregnant.
Yes. Are there any particular foods that should be avoided for fibroids?
Oh, dearest. I have, I have particular foods. Literature doesn't give you any particular foods that should be avoided. I haven't come across that. But people will tell you don't eat meats and red meat and things like those. But particular foods, I don't think so. I I'm not a woman or anything, But those are the things that people will ask you, what can I
Yeah.
eat? What can I? What should I avoid to eat and all that? I'll tell my patients, eat and whatever you want to eat, eat, but maybe try to avoid. We know that fibroids are connected with estrogen and progesterone. Okay, so things that can increase the amount of estrogen and progesterone, those should be avoided.
Okay, so during this pandemic season, what measures are in place to ensure that patients access or they're able to access the services that you guys have to offer and be safe at the same time?
All right. So unfortunately, Alicia, what we have now is that, as you know, during the pandemic, we stopped most of the elective surgery. We stopped most of the gynecology clinics. Okay. We have not stopped. We have not stopped any obstetric clinic. So all obstetric clinics, they are still going on as usual, as before the pandemic. Okay. Now, gynecology clinics, what happened is that we have people who really need patient urgent, okay? Like, well, if you are bleeding so much, you're anemic, or you've got cancer, or you've got, miscarriage, all that, those people, we still see them, okay? So we try to select, there is somebody will go, the patient will come and see who we can see immediately and who we can see later on. We give them appointment if there is no urgency to see them. But all those patients who we think that they are urgent they have to be seen, we still see them at this time.
Okay, thank you so much, Dr. Pedro. I want to thank you for the
Yes,
work that
Lisa,
you
can you
guys
see?
have been doing at the Ministry of Public Health, GPHC. I want to encourage you guys to keep up the good work that you've been doing. Thank you for joining us today. This is where we say goodbye for now on Health 360. Stay safe, Guyana.